Are you feeling like a failure when it comes to taking exams? Well, it may not be what you think it is. It may be that you need to adjust the way you apply your studying. And this presentation is going to be different because I've run into a lot of students who are struggling with exams and taking exams. And when we talk about things, when I quiz them, they are very intelligent. So I know that the information is within. It's just what I think it is a disconnect with applying that knowledge to the exam. And if you're having those type of issues that I'm describing, then this is for you. I'm Dr. Sharonda Sturm, and we're about to discuss how this application technique that I'm about to go over today in detail will help improve your exam scores and will help improve your critical thought process and application techniques. So all I need to know is, are you ready? I hope you are, because we're about to get into it. Listen, you don't have to tell me. You don't have to tell me. I know that care plans are probably the bane of your existence. Hell, they're the bane of educators' existence too. Okay, it goes both ways. Okay, no one wants to grade it, look at it. You don't want to do it. But if we can keep it nice, simplified, I'm going to show you how this care plan can singly handedly, when you are in your deep, difficult subjects and systems, how it can really help prioritize your thoughts and help you ace these priority questions. Let's look at what I set up here. So, priority are key data related to the chief nursing concern. We don't need to list a whole bunch of erroneous items that don't matter. And what I mean by that, let's say that you are grocery shopping, and let's say that you put in the cart oxygen, meat, honey bun. Now, you would like the meat and the honey bun, but if you don't get the oxygen, then you're surely going to die. And so that's what I mean by priority. So there's a lot of things we want to put in the grocery cart, but we need to limit it to the priority things. And I'm going to show you how that's going to correlate in future slides. So priority are key data related to the chief nursing concern. So that's whatever you thought of is the chief problem that you have correlated to this care plan. And I want you to add, forgive the typo, I want you to add Y items to each listed item. So if you said, for instance, oxygen was one of your priority items, why did you list that as? And that's for you. That's for you. The next one is the goal. It needs to be realistic, and it doesn't need to be 20,000 goals. It's only one goal. And whatever your goal is, just let it be realistic and have a time frame that's realistic. When we get into interventions and rationales, these probably have to be the two most important columns, because this is going to set how you direct your nursing thoughts, how you direct how you interact with that patient, and how you potentially may escalate or not escalate care. And so these are really critical because the rationales really explore your thought process of your intervention. And you don't get to those two columns without your data. Everything correlates to one another. And then you're left with your outcome, which should correlate to your goal. So now that we're all caught up there, we can move on to the case. All right, we have a perfusion concept case. Mahalia Jackson, a 41-year-old African American, admitted to the ED with complaints of nausea, lightheadedness, shoulder pain, unrelieved by NSAIDs. She mentioned she has been taking Tums for the past few days with unrelieved indigestion. A full workup is completed. CMET was negative. BMET was negative. BNP was negative. Troponin was 0.06. Chest x-ray was negative. And 12-lead EKG did show some nonspecific T-wave changes. All right. Now, moving forward, you individuals who are seniors and about to graduate, you are going to be experiencing the next gen NCLEX. And next gen is basically similar to what you would experience if you have really high value simulations where you have to look in the charts, have to evaluate the patient in real time, and make educated decisions. That's the kind of thought process you're going to be doing just on a computer. All right, so it's very important that you practice this way. So honestly, this is probably one of the best techniques I could ever express to you today. We want to start by breaking down this paragraph and highlighting keywords. Okay, so you would highlight all the key things that you think matter, that are priority. And that's what we're going to use to build our care plan. Okay, so take a moment to highlight those things. Listen, it's very important that we talk about that when you are dealing with women, you're going to have different symptoms possibly than men. They're going to show up differently. And the reason why I put the African American in here was so important was because a lot of their symptoms they're not going to perceive as a heart attack. And you just need to be really cognizant of that whatever you're going and studying in school, that you still need to be receptive to what you may see in your healthcare environment. And that may be very different. You need to be open to the fact that, certain things can be happening to these people, even though it's not what you were originally taught. So I think that flexibility is important, and that will help prevent bias in the medical field, because your generation can help improve all of those things. So moving back to Mahalia Jackson, what data then can we use? Well, we can, hopefully you extrapolated that shoulder pain would go here. So the pain, ooh, this is ugly. Indigestion. Ooh. That's ugly right there. I'm gonna just talk it out. Y'all can all right, and lightheaded. And then what we would do is put why. So why did you choose those as the data? You could maybe say this is important because although they're non-specific, these tend to be the symptoms that show up in women, or something like that. And next I would put maybe a section that said, let me see, a section that said labs. Okay. And what will go here? What would you list here? And so then I may list my troponin. Ooh, that looks ugly. Ooh. Troponin. And maybe I would also list any pertinent diagnostic studies, which would be my 12 lead. It doesn't have to be pretty. We're just showing up authentically as ourselves. So we're letting go of perfection. So troponin, what made that an issue? It was 0.06. That is indicative of cardiac injury, correct? And then the 12 lead, it was indicative of cardiac injury. And so that is the why. And so you're putting that in there for you. The teacher will like that you put it in there, but really that's for you. And now let's talk about the goal. Now that we've listed all of our things. So our goal would be, I mean, there's no right or wrong answer. Whatever you choose right there is what you choose, long as it's realistic and appropriate to the situation. So I'm putting the patient will have reperfusion within 90 minutes of admission. Okay. So our intervention. Remember that our intervention is going to correlate to our data. So if we got assessment data over here, we got labs, diagnostic studies, then our intervention should reflect our data. So the first intervention, as mentioned before, should always be something about assessment. So what would you put here? What I would say is assess the cardiopulmonary system. Why do we want to assess the cardiopulmonary system? We want to identify irregularities in heart, lung sounds, heart rate, and rhythm and blood pressure. Okay, that would give us more details about what's going on if we didn't have all our labs or diagnostic studies back. Okay, we could pick up on something and maybe at least escalate that to the provider. 2, monitor labs, specifically troponin, BNP, whatever labs that you think correlate to the main idea, the condition that you are writing on, that needs to be right here. And so we want to identify the cardiopulmonary lab, key to diagnosing the patient with MI if that's what we think this is. 3, we want to evaluate any other diagnostic studies. So 12 lead, what does a 12 lead say? Why is that diagnostic of our main idea of MI? 4, collaborate with multidisciplinary team to escalate care. Now this is very important, and that's what I mean by when we have our data out where we can see what we as nurses are looking at, like we're monitoring labs, we're monitoring diagnostic studies, we're assessing the patient first so we can get a baseline. Then we need to know, with all that data that we have, when it's time to escalate care. Like we know and understand with the patho of MI, if there are blockages that we need, this patient has to be moved to a care where we can understand where those blockages are and promote reperfusion in a timely format, right? So collaborate with a multidisciplinary team to anticipate care. What are you thinking is going to happen? That's the rationale that correlates to that. What do you think? What do you anticipate? Do you anticipate this patient may go to the cath lab? Then this is something that you would say here to restore perfusion. And this goes with my theme because my goal was that the patient would have reperfusion within 90 minutes. So now this is tying this all together. And then for number 5, I put institute standard protocols such as MONA. Now this could have been probably up higher. Maybe it could be number 2. But I really didn't put my interventions necessarily in a particular numbered fashion. But number 1 for me always will be assess. Number 1 always will be assess. So institute standard protocols, i.e. MONA. So what does MONA stand for? Morphine, oxygen, nitroglycerin, and aspirin. We know that in our rationale, it's going to explain all the facets of Mona. Why is morphine appropriate? Morphine is going to help vasodilate. It's going to help bring down, you know, what is that purpose? Why do we give it? It's going to help improve our cardiac output. Um, what about oxygen? What about nitroglycerin? Why is that important? Why is it a first line? What should we be aware of? And aspirin, why is that a part of it? So you see where I'm going with that? And so as detailed as you can get with your rationale, that's going to help your thought process when it comes to test taking. And now let's get into that. Let's put it all together and apply what we just did with some questions, potential test questions. Which of the following blood tests is most indicative of cardiac damage? A. Lactate dehydrogenase. B. Complete blood count, CBC. C. Troponin. D. CK. Now, this is more of a knowledge question. So you should be able to get knowledge. Knowledge questions you should not miss on the exam. That's just regurgitating definitions. So 100%, which is indicative of cardiac damage, immediately you should go to C, correct? Troponins. All right, let's try another one. This is more application based. So we have a sublingual nitroglycerin tablets begin to work within 1 to 2 minutes. How should the nurse instruct the client to use the drug when chest pain occurs? Take 1 tablet every 2 to 5 minutes until the pain stops. Take 1 tablet and rest for 10 minutes. Call the physician if pain persists after 10 minutes. Take 1 tablet, then an additional tablet every 5 minutes for a total of 3 tablets. Call the physician if pain persists after 3 tablets. Take 1 tablet. If pain persists after 5 minutes, take 2 tablets. If pain still persists 5 minutes later, call the physician. Now, this is an application style question only because it's not just asking you to regurgitate what nitroglycerin does, but it is asking that you understand the mechanism of how it works and so that you can adequately educate your patient. So now we need to find which one will work by process of elimination. We know that we're not going to take it until the pain stops. So 1 is automatically eliminated. We know 2 doesn't make any sense. Take 1 tablet and rest for 10 minutes. That doesn't make any sense. However, 3 and 4 seem plausible. And a lot of students sometimes get stuck between 3 and 4 and end up choosing wrong. Now, a lot of that is because maybe you're getting fatigued, or maybe you are reading the question too quick. So let's break it down. 1 tablet, then an additional tablet every 5 minutes for a total of 3. Is that a correct statement or not? We don't even have to move on. We will to just to verify, but that is a true statement. And then the second statement is also true. So I don't even have to second guess myself. 3 is the correct answer. Okay. Now, 4, 1 tablet, if pain persists after 5 minutes, take 2 tablets is what made that sentence wrong. Because we're only taking 1 tablet between 3 to 5 minutes piece. So 1 tablet every 5 minutes for a total of 3. And then call the physician. So the only answer could be 3. Okay, so it will, if you've clicked the button along with me, it's going to take us to this NCLEX question. And we're going to click on 11, okay? And so 11 says, while caring for a client who has sustained an MI, The nurse notes 8 PVCs in 1 minute on the cardiac monitor. The client is receiving an IV infusion of D5W and oxygen at 2 liters a minute. The nurse's first course of action should be to A. Increase the IV infusion rate. B. Notify the physician promptly. C. Increase the oxygen concentration. D. Administer a prescribed analgesic. Now, with us setting this paragraph up in our heads like a care plan, before we even look at the answers or the possible answers, we need to select in this paragraph what are the main ideas. And the main ideas is, let's see, they sustained the MI. So I might highlight that. The nurse notes 8 PVCs in 1 minute. So I'm going to highlight 8 PVCs in 1 minute. Now, the client receiving IV infusion of D5W and oxygen at 2 liters, that's a statement. I don't know if it means anything though. I mean, meaning it's not pulling any data any way. So I don't know what to do with that. So I'm not really going to highlight that at this point. And then the next statement is the nurse's first course of action should be. So this is a prioritization question. And I've got all the things highlighted. Now, before I go on, I'm going to reread it one more time. I've highlighted 8 PVCs in 1 minute and MI. And then I just want to make a quick jot before I look at the responses and say why I highlighted what I did. And it should be only in 1 or 2 quick words. So MI, I know what that means. Reperfusion issue, XYZ. 8 PVCs in 1 minute. Let's see. PVCs, multiple PVCs can lead to VTAC. Okay, so I've got that down. All right, so let's go with A. Increase the IV infusion rate. Now, what does that have to do with my client being okay? Because remember, if we're talking about priority, then whatever I choose needs to prevent death or sustain life at the highest capacity, whichever way you want to look at it. But that's how you need to look at it. What is going to prevent death by my action? Is increasing the fusion rate going to prevent death with the highest regard to this patient's safety? No, it is not. B, notify the physician promptly. Well, I mean, I don't know. Sometimes my nursing faculty say, don't always call the physician, and maybe that's just too easy. So I'm going to skip that for now. C, increase the oxygen concentration. Well, where does it say that the client has decreased O2 sats? It just says that the patient's on 2 liters of oxygen. Maybe they're on 2 liters for comfort. We don't know. We don't have enough data to say that we need to increase the oxygen concentration though. So that one's out. Administer a prescribed analgesic. Now, my nursing instructor always said pain is the 5th vital sign. And so that's pretty important here. I think notifying a physician promptly, that's just too easy. I'm going to go with D. All right, so if you went with D, and if this is what you do, then there's help for you yet. First, you need to acknowledge that these questions are just questions. They're not questions to set you up. They're not questions to trick you. It is what it is. And so you have to get out of the mindset that someone's trying to booby trap you. It's not in the best interest of your faculty or that fine institution that you attend to make it so that you can't get through nursing school. All right? Questions follow rules and guidelines. It's up to you to understand how those rules and guidelines work so that you can see the question for what it is, and that's it. Now, although pain is the fifth vital sign, there's nothing in here in this paragraph that mentions anything about the patient being in pain, having pain, or suffering from pain. And is that the priority to prevent death for this patient? If we go back to our care plan and what we listed for our assessment data, if we prioritize that list, how would this fall in the scheme of things? And so if we're looking at this paragraph, what we need to go back to what we made our notes from. And that was we highlighted MI and we highlighted 8 PVCs in 1 minute. Why did we highlight that? Because we know that frequent PVCs lead to VTAC. And VTAC is a lethal rhythm that can take them out of this sphere into the celestial plane. And that is why it is the most appropriate to notify the physician promptly. So it's really hard as a person and an educator to tell you that it's never wrong to it's always wrong to notify the physician. You just need to think critically. If there's nothing left for you to do with your nursing judgment and nursing critical thought process, then you must escalate that care. That is the best shot that that patient has for a future. And that's why B is the best answer. I really enjoyed going through this with you. I know this was one of my longer videos, but I think it was very important for me to really deep dive with you with this technique and how it can really be beneficial to you. I will let you know right now that your grades, what you make on the exam, will correlate what you do outside of that classroom and how you improve your application techniques. I have been with many students helping them improve their test taking strategies, and they have increased their exam points by at least 10, as high as 20, with some of the techniques that I've gone through with them. So this is not a game. And you can beat this because anything with rules, guidelines, and regulations, as long as you understand what is and what the components of a question have to be, then you can understand how to tackle it. And I'm here for it. Your comments, sharing is huge to build up this community so that everyone can be successful. We don't have to be in competition with one another. There's room at the top. And so just having a community and sharing your knowledge with one another and building one another up is going to help you be a stronger class, be a stronger individual, and be that much successful in practice. And I am here for it. I'm Dr. Sharonda Sturm, and I hope you enjoyed this. And always remember, you are enough.